Hello, we are Carolina Cortez, Brianna Garcia Quiroz, Edgar Hidalgo, Janet Romero, and Ariana Romo. We are presenting our project titled Implementation of Multimodal Alternative Therapies for Anxiety Reduction. Generalized anxiety disorder, or GAD, affects millions of adults worldwide. While standard treatments such as medication and cognitive behavioral therapy are widely used, many individuals continue to experience persistent anxiety symptoms despite appropriate care. Recent evidence shows that alternative therapies, non pharmacological therapies such as yoga, mindfulness, and relaxation techniques can effectively reduce anxiety and enhance overall well being when integrated with traditional approaches. Our evidence based project aims to explore how nurses can implement brief, non invasive, and cost effective interventions at the bedside to support anxiety reduction in adults with GAD. By combining evidence based strategies with practical nurse driven implementation methods, we hope to demonstrate the potential impact of multimodal alternative therapies in everyday clinical practice.
Our PICO question has guided the entire project. We asked, in adults with GAD, how does the use of alternative therapies compared to standard care alone affect anxiety symptom reduction over a 6-month period? This question allowed us to focus on measurable outcomes and to evaluate how alternative therapies could meaningfully impact long term anxiety management.
The literature strongly supports the use of nurse delivered psychotherapeutic and complementary interventions. Studies show that nurses are effective providers of psychoeducation, mindfulness based strategies, and even structured psychotherapeutic approaches such as CBT. Additional evidence highlights the benefits of creative and sensory based modalities, including coloring activities, diaphragmatic breathing, guided relaxation, massage therapy, and music therapy. Across multiple systematic reviews and randomized clinical trials, these interventions consistently demonstrate reductions in anxiety symptoms, improvements in emotional regulation, and enhanced patient satisfaction. Importantly, they are low risk, low cost, and can be delivered in short intervals that fit well into busy inpatient settings.
Our implementation model focuses on simple, accessible nurse led interventions that can be performed in as little as 3 minutes. For each shift, nurses offer one alternative therapy based on the patient preference or clinical stability. Options include mindfulness breathing for 3 to 5 minutes to slow the stress response, relaxation or music therapy for 5 to 10 minutes using calming audio, gentle chair based stretching for 3 to 5 minutes to reduce muscle tension. Importantly, interventions are designed to be adjuncts to standard care, not replacements. Nurses document pre and post intervention anxiety scores using the GAD 7 scale, along with patient feedback and its response. This structured documentation helps track progress and ensures the interventions is both measurable and consistent.
We evaluated several outcome measures based on existing research. GAD-7 improvement studies show patients often experience a 4 to 6 point decrease after mindfulness and relaxation techniques, which represents a clinical meaningful reduction. Response rates between 54 to 70% of patients show at least a 50% reduction in symptom after yoga or stretching interventions. Remission rates are up to 60% achieve full remission with therapies such as mindfulness and music therapy within 6 weeks, and benefits often persist for months. Physiological outcomes: music therapy, for example, lowers heart rate, reduces cortisol levels, and produces measurable decreases in anxiety. Patient satisfaction: more than 90% of participants report that brief nurse led sessions are helpful with low dropout rates. These outcomes show strong potential for integration into routine clinical care.
Our SWOT analysis helped identify the practical considerations for implementing this program. Strengths include the fact that these therapies are evidence based, non invasive, and cost effective. They require minimal equipment, and nurses can deliver them quickly during routine care. Weaknesses involve potential limitations such as staff time constraints, the need for training, and possible resistance from clinicians unfamiliar with complementary therapies. Opportunities include strong institutional support for mental health and wellness initiatives, potential grant funding, and the ability to expand this model to other units such as ICU step down or behavioral health. Threats include inconsistent participation, staff burnout, and leadership turnover, which could impact long term program sustainability.
In conclusion, integrating multimodal alternative therapies into standard nursing practice offers a meaningful opportunity to enhance anxiety management for adults with GAD. These quick, accessible, and cost effective interventions can reduce symptoms by up to 40 to 60% over 6 months when paired with routine care. While barriers such as staffing limitations exist, the overall evidence strongly supports pilot implementation and further evaluation. Ultimately, these interventions empower nurses to play an even greater role in mental health and support holistic patient care. All references used in this.
These are our questions for our audience. We learned that up to 60% of patients can reach full remission within 6 weeks using mindfulness or music therapy. What do you think might affect how consistently or successfully these interventions can be implemented in a real clinical setting? And since over 90% of patients report being satisfied with brief nurse led sessions, how do you think this kind of positive feedback could help support additional multimodal therapies into everyday nursing practice or unit policies?
Given everything we've shared, how do you think nurses can fit brief mindfulness or music therapy interventions into their normal workflow? This concludes our EBP presentation. Thank you for your time and attention.